Perinatal depression and anxiety amongst new parents comes at a huge cost, affecting 1 in 5 new mums and 1 in 10 new dads. But it's not just an emotional cost. The financial impact of PNDA in Australia is some $877 million a year, according to a new report. On the eve of Perinatal Mental Health Week, we're joined by the CEO of Gidget Foundation, Arabella Gibson, and New South Wales Minister for Mental Health, Bronnie Taylor, to discuss what is being done to address the condition. Arabella and Bronnie, thank you so much for coming in. I know you've just been with the bushfires up in Taree, so a lot going on up there, and very kind of you to spare the time to talk to us. Arabella, if I can start with you, we know that the stigma's broken down a lot, thank goodness, about perinatal depression and anxiety. So we do know a lot about the emotional cost of that and the toll it takes on parents' mental health. Can you talk us through how that shows up, how it manifests? What are the symptoms?
Yes. Well, over 50% of new parents will experience adjustment disorders, and when you consider that we have 600,000 parents every year, new parents every year, that's 100,000 Australians who will experience perinatal depression and anxiety. So the symptoms consist of things such as a feeling of helplessness and hopelessness, not being able to leave the house, constantly worried, unable to enjoy the things that they may have been able to enjoy before, things like insomnia, anxiety, and a feeling of frustration and anger can often be the case as well. So it's obviously different for every person, but I would suggest that if people are at risk or feel that they might be at risk, to go and see their GP.
So this emotional toll is, as we say, it's extraordinary. It really does impact incredibly mainly the parents, but as we're going to talk about later, other members of the family as well. But for the first time, we can see the financial cost of PNDA. You've got a study that's shown, it's the first study in 7 years to show that the cost is $877 million. That is extraordinary. How's that broken down?
Thank you, both of you.
So PwC have released this report in conjunction with the Perinatal Mental Health Consortium, and as you said, $877 million. Of that, $634 million is allocated to the economic cost of things such as absenteeism, presenteeism, the productivity losses around those sorts of things, plus also having carers to look after Bub while mum and dad might be struggling with the issue. Then we've got $227 million, which is allocated to health. So that's primary health, both through community and the primary health system, but also in those acute situations where mum or dad might end up in a hospital admission scenario. And then we have a further $7 million, which is allocated to a wellbeing cost, and that's in relation to the impact on the infant. So things such as a child experiencing anxiety, depression, but also developmental disorders, things such as ADHD, so that kind of thing.
What you offer at Gidget Foundation, which is an extraordinary foundation, is this counselling for new parents. Such a vital, I mean, it's literally a life-saving service. A lot of those centres, you're now expanding into the bush. Bronnie, why is it so important to have this kind of support in the bush?
Yeah, look, so important, because what we know is if we can bring services to communities, we have much better outcomes. So it's about accessibility, but it's also about people being able to stay in their own community and access that help because they've got all their support networks around them. So when we remove mothers with their children from their communities and from the people they know, and they have to travel long distances and be away, we know we're not going to get the same outcomes. And already we're hearing from our centres that we've recently opened some really fabulous results and fabulous feedback from families.
I know you've opened quite a few centres in regional areas. Who wants to tell me about that, the numbers?
Yeah, well, we've opened 5 in the last year actually, which has been exciting, and it's been a wonderful partnership between Tresillian and between Gidget. So we've actually been able to have these Tresillian centres in Queanbeyan, Coffs Harbour, Dubbo, Taree and Broken Hill. And then what we do is we have Gidget there as well, so that if a mother or a father, if a family's coming in and they're experiencing some issues, we've actually not only got the Tresillian nurses and specialists on site, but now we've got Gidget as well. So everyone working together for our rural and regional families. It's terrific.
And if people can't access those centres, the other wonderful thing that Gidget offers is this remote counselling. How does that work?
Yeah, that's fabulous. Do you want to?
Yeah, so that program is called Start Talking. It's a national telehealth service, and it's offered via video counselling. And we, with the support of the New South Wales government, have been able to roll this program out to have 10 free clinical psychological sessions available with perinatal mental health specialists. And to access that service, people just need to get a GP referred mental health care plan and contact the Gidget Foundation on 1300 851 758.
This is, as we said, the eve of PNDA Awareness Week, so we're about to see a whole week of focus on this really vital area. What would you say, Arabella, that you want to see people get out of this? What more do people need to know about this?
I think, as Bronnie mentioned before, you know, really getting people to start talking and break down that stigma and understand that there is support, there is help out there, and that this illness is a recoverable illness. People don't need to go on for months and years feeling the effects of perinatal depression and anxiety. When there is support out there, they can address it and they can move on and go on to live a really happy and fulfilled life.